Thanks very much, Shan, and thank you for inviting me along to this seminar on mental health in the workplace. And we're getting in a week early for Mental Health Week next year. And it's good to see the topic of mental health coming up as a much more general topic in the community. And when it comes up and is discussed in everyday settings such as the workplace, it helps it be the kind of mainstream issue that it should be, because when it boils down to it, all of us experience variations in our mental health as we experience variations in our physical health. Sometimes mental health is used as a euphemism for mental illness. And when we're talking about mental health, often notions come to mind like anxiety or depression or schizophrenia. And I will talk about anxiety and depression today as some of the main conditions or most prevalent conditions where people have more significant mental health problems. But apart from that, I think that if we're looking at recognising mental health issues in the workplace, it's worthwhile recognising mental health issues in ourselves, not necessarily looking at just circumstances where someone has a significant mental health condition or a mental disorder, but also looking at when there's some kind of variation or some kind of loss of well-being that we might experience ourselves in certain ways. And when we recognise the variations in our own mental health and well-being, we're more likely to recognise the variations in others. So some of the topics we'll be looking at today. First of all, the notion of recognising burnout, because burnout is something that I think that most workers will experience at some stage in a career, probably many times. Actually, I'd be surprised if someone who looked to approach things with any degree of challenging themselves or ambition or interest in achieving the most that they can, I'd be surprised if anyone in that situation would not at times experience burnout, taking on somewhat more challenges than is comfortable, or having to push to meet deadlines in a certain way, or taking on extra at times to help cover for some difficulty within an organisation. There are circumstances which may arise, which means at times we will take on greater levels of stress. And the thing then is it's helpful to recognise when that's reaching a point where it's leading out to our well-being deteriorating. We'll also look at how mental health problems might present, and part of that will be looking at anxiety and depression as the most common mental health conditions. Demystifying anxiety and depression, you'll see that a lot of the symptoms of anxiety and depression also overlap with the symptoms of burnout when our own stress levels might increase. Reducing the stigma, I'll talk about some strategies or tips that I think can help reduce the stigma of mental health problems, and also looking at ways of enhancing positive work culture and mental health. Geelong has benefited from being the location for the introduction of positive psychology at an institution-wide level. I'll talk a bit later on about the field of positive psychology, which looks at enhancing our mental health and well-being, not only alleviating symptoms or distress, but adding to our positive mental health. And the first large institution-wide project on positive psychology was introducing the principles of positive psychology into Geelong Grammar School. And so that was done to apply positive psychology principles organisation-wide for children from kindergarten through to year 12, including the training of teachers and all staff, with a view to understanding factors that might add to people's mental health and well-being and looking to incorporate that within the culture. And there's some principles from positive psychology that can be well introduced or well applied in any work setting, and I'll describe some of the most useful principles later on. First of all, if we think of the link between work and mental health and well-being, there are 5 different levels or 5 different components of well-being. Often when we talk of well-being or positive mental health, we think of happiness. But that is just one of 5 dimensions. Happiness relates to positive affect or feeling good. But there are a number of other dimensions that relate to our mental health and well-being. There's also engagement. Engagement is when we're very absorbed in the kind of things that we're doing. We're performing roles that suit us. When we're energised and enlivened by there being a good match between our interests and the kind of work that we're performing. Then there's relationships. Many of us make friendships through work. We might have mentors through work. Also, people might have people that they're supervising or helping or supporting, and we have work peers. So there are many of our everyday relationships that we form through work settings. Then there's meaning. For many people, through our work, that's one of the ways that we express our purpose in life. Things that engage us, that we're interested in, things that we're passionate about. And if we find work that suits us in that way, or we find aspects in our work that most engage us, or that we find meaning in, that also enhances our well-being. And then there's achievement. And so achievement can be meeting a particular goal, it can be completing a project, it can be supporting a colleague in a certain way, it's providing a service. By definition, if we're in paid employment, we're doing something which people find beneficial to them. And so to be able to do that well is something which is likely to add to a degree of achievement. So one of the things, when we think of mental health in the workplace, I think at first of what are some of the ways that our workplaces help us experience positive emotion, engagement, have positive relationships, find meaning and achieve. Because workplaces naturally provide opportunities for each of these things. But similarly, if you think of work environments where things aren't working so well, and I think most of us in this room will have experienced some work cultures. It might be in the same setting that used to have a positive work culture, but it mightn't have remained that way, or there might be complications that have come up or difficulties in a particular work culture. And I think that when there are difficulties in work culture, it will tend to impact on these areas where you'll notice that the mood is different, where people aren't as engaged in their roles. There might be more complaining or expression of difficulties or problems or frustrations. Relationships, there might be conflict that is unresolved. People might find less meaning in their work, or they might feel less appreciated. Or otherwise people might feel blocked from doing their job as effectively as they could, or otherwise feel that their skills aren't being used as well as they could. Or in other ways feeling they're being overlooked for something that they could contribute to. So we can see that for each of these areas, workplaces can enhance our opportunities in each of these areas, but also can detract. And so I think that if we focus on those kind of aspects with a view to helping us have positive work environments and work cultures, that is also a good way of helping individuals maintain good mental health. When we talk about mental health, we're largely talking about stress. And all of us will have a certain level of stress that we might experience above which we will start to experience symptoms. I'm going to describe some of the symptoms, physical, emotional, thinking kind of symptoms that we can have when our stress reaches certain levels. And I'll describe how each of us has a certain kind of stress signature. And a lot of what's important with understanding mental health is understanding our own ways of responding to stress, because we all have somewhat individual ways of responding to stress. Stress is universal, so for all of us mental health is an issue, because all of us are going to experience at times stressful circumstances that might really tax us. All of us will likely experience grief. If we're going to have positive, meaningful relationships, then if those relationships end, as ultimately many relationships will end, including from people leaving, but certainly through death of family members. That's stressful. That affects our mental health and well-being. That's a normal life circumstance, albeit a challenging life circumstance, which affects our mental health and well-being. So stress is universal. Now, perception is a common source of stress, meaning how we view things. If we view things, say, through a prism of perfectionism, where we have to achieve to feel that, at a very high level, to feel that anything that we do is good enough. Or if we have excessive concern about other people's approval, we think we must have that person like me for me to feel worthwhile or whatever. It's not just the objective circumstance that leads us to feel stress, but also our attitudes to achievement, to approval, to dealing with discomfort. And so when it boils down to it, it's what kind of take or perspective we have of situations that makes a difference. And that's where it generally helps to have a somewhat more positive or optimistic attitude rather than a more pessimistic attitude, the glass half full, so to speak. Stress is not all bad. Many of us will function better if we have a certain level of stress. And actually there's a diagram that a number of people might have seen about our arousal level or anxiety level and our performance. If our arousal or anxiety level is very low, more to the left-hand side, our output will tend to be quite low. Then, once your arousal level and our level of arousal overlaps with the level of anxiety. If someone is on a roller coaster having a lot of fun, they have a high level of arousal, but also they might have the same kind of symptoms, if you like. Their body might be reacting in the same ways if they're anxious. Heart beating faster, breathing a bit quickly, tighter muscles. So anxiety and arousal overlap in how our body functions. So it's only at more moderate levels of arousal that we're going to be able to perform in our most effective ways. And that's where, for many of us, much of the time we're looking to perform at more moderate levels of arousal. Not always trying to keep up at the top of the curve kind of thing. Sometimes it is worth pacing ourselves in different ways. But ultimately, if we look to be relaxed all the time, our output would not be so high. But there's a certain point above which our arousal or anxiety levels can increase and our performance will go down. And that's what various sports people have to deal with. And if at a certain stage of competition, if people start to feel more anxious, that can interfere with performance. Whereas at the start, if people aren't fired up to a certain degree, they're not going to get the most out of themselves either. Well, that relationship between arousal and performance doesn't just apply in the sporting field, it also applies in our everyday productivity. So stress is not all bad. There's helpful levels of arousal. Also, our healthful stress levels will vary. And we might tolerate more stresses of a certain type. And that's individual as well. Some people might find it very stressful to work in a remote environment. For other people, that mightn't be so much. Some people might find it a real burden having a lot of supervisory responsibility, whereas someone else might love a supervisory aspect of their role. Someone might really struggle with meeting certain deadlines if they're struggling with perfectionism or the expectations they're putting on themselves to meet them, whereas someone else might like having deadlines to motivate them to achieve at a certain level. So there's individual differences in how we respond to stresses, and part of it is being aware of the kind of things that we respond to, the kind of things that are our triggers, if you like, for being more stressed. And then what really helps is to pay attention to our body, so our physical reactions, our emotions, and our relationships, because the way that each of us respond to stress, and I'll describe some of the burnout symptoms shortly, that overlaps with symptoms also of anxiety and depression, which tend to be somewhat more severe or extreme forms of the same kind of stress reactions that we will have in normal stressful circumstances. So if we look at burnout, that is where the demands on us at work outstrip our resources. So the demands might be the amount of work we have or how quickly we're meant to perform it, or whether it involves aspects of our work which we find more challenging. So for some people it might be taking extra levels of responsibility in certain areas. And our resources, that relates to our coping skills, it relates to the supports that we have from colleagues, it relates to the equipment that we've got that we can draw on. And when the demands on us outstrip our resources, so the demands are greater than our resources, that's when you start getting burnout symptoms. So someone might have a very high tolerance for stress, but once the demands on them increase to that level, and then a bit above that, that's when people will start developing more burnout symptoms. And so it's worth being aware of these signals that we have that tell us when we are reacting with more stress. Often when people experience burnout, and how many of us here might relate to it at work, the kind of pressures that contribute, it might be time pressures, so a lot of demands to achieve a certain workload or output in a particular time frame, excessive responsibility, including responsibilities that we mightn't like so much, excessive expectations. And I've mentioned perfectionism a few times because that's the kind of attitude or mindset that leads people to be most susceptible to depression. And yet it's got a positive side in terms of conscientiousness. When people are perfectionistic, they tend to be, they take their roles seriously, they want to perform well and be productive and provide a good service often for other people, but it can become rigid at times. People can put more pressures on themselves than is warranted, and then that can lead people to be more susceptible, not just to further stress, but also anxiety and depression. Also limited supports. So the idea is to be aware of our own stress signature. Signs of burnout that a number of us might have experienced at some points along the way are feeling that there's not enough time to do what you feel you have to do, wishing you had more support, feeling overwhelmed generally. It can lead to physical symptoms like difficulty falling asleep, cognitive symptoms like forgetfulness, a feeling that you're not meeting expectations or that other people aren't meeting expectations, so more irritability and frustration can come in. And people can find it hard to give to themselves. So one of the things that happens with burnout with health professionals, for example, is they experience a bit more distance from their clients, thinking, look, I'm not looking forward to seeing the next person that I might see or whatever. And also people can find it harder to give to themselves. One of the vicious cycles people can get into with burnout is feeling more stressed. People can sometimes feel, I need to do more and more to feel that I'm doing enough so I can relax, and yet get caught up in a pattern of forever chasing one's tail. And so that's where it helps to pick the build-up of stress when it's occurring and to keep tabs on it, so to speak. Now, these are some of the most common symptoms of burnout, and there are 5 different areas that I'll go through: physical, emotional, cognitive, relational, and spiritual. And this isn't a complete list, but these are some of the more common kind of things. So when people become stressed to a certain degree, might experience aches and pains or headaches, or might have some difficulty either getting to sleep or making up in the middle of the night, and feeling tired, fatigued, feelings of restlessness, muscle tension. There might be a change in people's appetite, either eating less or comfort eating, stomach complaints, and greater susceptibility to illness such as colds. There are emotional symptoms such as feeling more worried or anxious or nervous, feeling frustrated, irritated, feeling sad or depressed, having more variation in mood or mood swings, getting a sense of little joy from everyday work or experiences, and feeling discouraged. Then there are mental symptoms such as forgetfulness or poor concentration. So poor concentration is one of the more sensitive indicators when our stress is reaching a certain kind of level. Low productivity, feeling bored, feeling confused, becoming more distractible or spacing out, and negative self-talk. And as I go, each of these things you can experience in a more mild way, but if you have more of these reactions more intensely or more severely, and it lasts for longer, that's when it overlaps with anxiety disorders or depression. Our relationships can be affected, can tend to be a bit more withdrawn, can be a bit more intolerant of others, feel more lonely, have fewer social contacts, more arguments. It could be nagging, more arguing at home, distrust, a sense of reduced intimacy. And the idea of these things is not to think of them as just, oh, these things are bad. It's recognising that it's natural we're going to have some of these reactions if our stress levels get to a certain point. So the thing is having an awareness of the kind of reactions we have. What are the kind of things that first show up for us if our stress is getting to a certain level? What if we're mildly stressed? Is it that our sleep's a bit affected, or our concentration's a bit affected, or we become a little less likely to catch up with friends or whatever? Because for some people, one of their first signs might be being more withdrawn or getting headaches, but for someone else they mightn't have headaches or get more withdrawn. For them it might be that they have difficulty sleeping or use more alcohol. So it's recognising what our own patterns are, mild levels of stress, moderate and more severe levels. And then there are spiritual symptoms relating to meaning in life. So there can be feelings of emptiness, loss of meaning or purpose, loss of direction, apathy, cynicism, feeling less forgiving of oneself or others, and a sense of disconnection from yourself, from others, from things that are meaningful to you. So I would think that with this list that we've had a look at, each of us could recognise some reactions we've had. We've been more mildly stressed, we've been more moderately stressed, and what happens to your sleep, for example, when you go from being mildly or moderately stressed to more severely distressed. Fewer hours, it might be not just some difficulty getting off to sleep, it might be also waking up a bit more in the middle of the night or whatever. The thing is recognising our own stress signature, because once we recognise that, we can intervene earlier. Okay, now how might mental health problems present in the workplace? Well, it will be from people having some of the kind of reactions we've looked at just in the last few minutes. And you'll recognise that some of those reactions are quite internal. So we're not always going to know, with a number of people, we're not going to have much clue at all of whether they are experiencing a mental health problem like anxiety or depression. And that's part of the reason for forums like this and looking to destigmatise mental health issues, so it makes it easier for people to acknowledge if they are struggling. Because that's the main way we know when people are experiencing significant mental health issues, if they can declare or say, express to someone that they're struggling or having difficulty. But by the same token, what we might see from the outside, I'm going to go through some anxiety or depression symptoms shortly, and some of these are more visible in terms of other people's, how they might present. But often it might show up as a person not seeming to be their usual self. They mightn't seem to be as bright or as jovial or connecting as well or talking as much or contributing as much to things. They might seem to be withdrawing more from certain situations. So a sense of the person seeming a bit different from how they usually seem. And especially if they are more socially withdrawn, if people are making more mistakes or have reduced productivity, it mightn't just be because they're not so interested in their work or they're not so conscientious or whatever, especially if there's a change, especially if there's some fall off in people's presentation. It could be that someone is experiencing more stress in a certain situation. We'd immediately recognise and accept that if we knew that someone had recently lost a parent or a partner. And we'd recognise that and think that's normal. We'd make allowances for the person maybe being a little bit more forgetful in certain ways and not seeming quite their usual self. But there can be other things that are happening in people's life as well that have just as much impact as losing a family member. So it's allowing for that. Also, there are certain times, for example, for some women going through menopause. There was an article in the paper recently about how someone noticed they were making more mistakes and it was affecting their productivity, and it was a normal life physical issue that was affecting the person's cognitive functioning for a period of time, their mental health. And so once the person recognised that was a health issue and looked to address it, then not only did they feel much better, but their performance at work improved and all the rest of it. Avoidance of situations is a potential indicator of the person feeling less assured or less confident of what they're doing. But I've highlighted these last couple of ones if the person's admitting to struggling or acknowledging a mental health problem, because so many of the symptoms and the impact of mental health problems are internal. How are we really going to recognise mental health problems in the workplace unless workplaces are relatively safe places for people to acknowledge, hey, I'm struggling, there's something affecting my performance, it does relate to my health or well-being, I'm really prepared and looking to do what I can to help that situation because I know it's better for everyone if I do, but for my own sake I'm going to pursue that. But I think it's worth people knowing that I am struggling a bit at the moment and I'm looking to do something to address that. I think that would be a far more enlightened kind of workplace. I think it would help people identify and acknowledge difficulties sooner and seek effective treatments sooner, because one of the main themes of mental health problems, and one of the most important things to recognise, is virtually all mental health problems are treatable, and most people fully recover from most mental health problems. So by people being able to address things earlier, it helps. But currently, many people might be wary of how others experience, how others might respond to acknowledging a mental health problem in the workplace, and that's something that we're looking to change, including through forums like this, because if people can acknowledge they're having difficulty, then there's more that can be done about it. Now I'll talk about some of the main patterns or symptoms of anxiety and depression, because most people who suffer from mental health problems, or virtually all, will have some kind of combination of anxiety and depression symptoms. And say for a private psychology practice, or working as a psychologist in psychiatric hospital settings for many years, the main difficulties that we'd encounter are anxiety and depression, perhaps trauma reactions. Even though there's some very significant other conditions like schizophrenia, bipolar disorder. These are very important difficulties to address, and they're good treatments for these significant conditions like schizophrenia. But again, a lot of that would apply to usually just a few % of the population. Whereas if we look at anxiety, it's something like 1 in 3 women, 1 in 5 men at some stage in a lifetime. And so it's much, these are the more prevalent conditions. Anxiety relates to a perception of threat. So it's where we get a fight or flight reaction. The feelings that we get with anxiety overlap with panic. So if suddenly a lion appeared at the corner of the room, we would experience a number of panic-related anxiety symptoms, because that's getting our body ready to fight off an attacker, or to flee. So things like there'll be more muscle tension getting ready to fight or flee, we'll be breathing more quickly, and so there'll be a number of changes that happen that way. Maybe feeling hot as a result of more blood flow. But in terms of the more common persistent reactions with anxiety, it's things like restlessness, muscle tension, aches and pains, feeling nervous or scared or worried, irritability, sleep problems and fatigue, and difficulties in concentration. And these symptoms also overlap to a degree with depression. But this is when it becomes more persistent and chronic anxiety. These are some of the more common patterns that show up. And, but there's certainly others as well. Now, when anxiety particularly becomes debilitating is when it relates to certain conditions that can vary from being fairly mild to fairly severe. And so many anxiety-related conditions, people can make very good progress in addressing those conditions in something like 10 to 12 sessions of therapy, very often. But the kind of anxiety conditions that are more common are phobias, and so quite a number of people might have like a snake phobia or a fear of heights, or some people might have a fear of going in enclosed spaces or whatever, and it's a more discrete fear of a particular situation that people feel very anxious when they're there, they look to avoid it. Sometimes phobic reactions can be more hidden, like social anxiety, and there might be someone who really fears the idea of being allocated to a front desk. And they mightn't have declared that, but they feel very nervous when they come under other people's scrutiny, or when they're very visible. But they might be very happy working in an office in the background somewhere. So that's another more common anxiety condition, social anxiety disorder or social phobia. Then generalised anxiety disorder is when people have persistent anxiety symptoms like restlessness or muscle tension or those lower symptoms. If people have those, at least a couple of those symptoms most days for a period like 6 months or so, combined with persistent worries in at least a couple of areas. So it's like a worrying kind of condition, a generalised anxiety disorder. An obsessive compulsive disorder is for example, when people have to wash their hands very frequently through the day, or people might be checking the locks of their house. It might take someone an hour and a half to check their locks before they go to bed. It overlaps with conditions like hoarding disorder, where people might continue to collect all sorts of relatively useless items and find it difficult to let go of. That's a bit of a different kind of thing, but it overlaps with obsessive compulsive behaviour in some ways. And then there are trauma reactions, such as if a person's had an industrial accident where they nearly lost their life, or if a person has had a motor vehicle accident, and at times people might have flashbacks or nightmares going back to that original situation where their life was threatened. And people might also find that they look to avoid that situation, like they find it hard to get back driving again, or there's certain situations that they would find it very hard even to drive back past the workplace where they were nearly killed in an industrial accident. So that's another more common kind of reaction. The thing is, when people acknowledge having any of these anxiety disorders, there are good treatments for them. And the earlier people seek treatment, that tends to help people's recovery. But it's going to be, we're not going to just be able to observe these kind of reactions in someone else. It'll more be if someone can say or acknowledge they're having difficulty in a particular way. And then if someone does acknowledge a difficulty and they get treatment for it, not only do they likely recover, or sometimes even with the more severe or chronic conditions, people learn to manage it a lot better, so it doesn't interfere with their work performance so much. And so then everybody is better off. These are the 9 symptoms of depression I'll be going through, where what a clinical depression is, or a major depressive disorder, is when people have at least 5 of these symptoms most of the day for most days for at least 2 weeks. And they overlap with reactions that people would have for grief as well, and certain other circumstances. But if people have a depressed mood, meaning feeling very low in spirits most of the day for most days, for 2 weeks. If people have lost interest in activities, find it hard to get pleasure from anything, for most of the day for most days, for 2 weeks plus. If people have difficulty sleeping most nights, or more rarely, oversleeping. If people have a loss of energy or persistent fatigue, if people have a disturbance of their appetite, markedly reduced is the more common, but sometimes increased appetite and weight loss or gain, again over a couple of weeks. If people are slowed down in their movements to the point where that's visible to others, or very agitated. Now, if people were slowed down in their movements to the point where we noticed it as a result of depression, they would typically be fairly severely depressed. And yet that's one of the more visible of these kind of reactions. So it just shows that we're not going to just be able to tell if someone's depressed from looking at them or working with them. Poor concentration, difficulty making decisions most of the day for most days. Feelings of persistent guilt or worthlessness, and suicidal thoughts or thoughts of death. Now, as a psychologist, if we see people who come in with 5 or 6 of these symptoms, and if they come along soon after, within, like say, a couple of months of them developing, we're very confident of helping those people, typically within about 10 sessions of therapy. Also, antidepressant medication can be relevant for people in helping overcome these symptoms, especially if it's more severe. For mild or moderate depression, then typically psychological therapy alone would tend to do well, and also physical exercise. Physical exercise is as effective as antidepressant medication if people have mild or moderate depression. So it's recognising that this is one of the more common or significant mental health problems or mental disorders in the community, and it's well addressed and often very effectively addressed. And even when it's more severe or prolonged, people can learn to manage the condition better and commonly make a full recovery in time. And I'll just mention as an example that I went through 2 severe depressions myself. One was as a student when certain circumstances happened in my life that were very stressful, but one was when I'd been working for 10 years at the psychiatric hospital in Geelong. I'd been the senior psychologist for the last 5 years. And I was admitted to hospital twice. I was hospitalised twice and off work for 6 months with depression. That was 25 years ago. I thought my career would be over, partly because of the stigma. I thought people would not take my capacity to work seriously in the mental health field. 25 years ago, I haven't had a day of depression since I recovered, but it took me about certainly 6 months to make the major recovery and 2 years to make a really full recovery. And I now see it's been one of the greatest advantages for my career of any experience I've had, and I experience minimal stigma. I usually get a sense of having a little bit more credibility from it. But I thought at the time, I believed I would never get well when I was depressed, and I also thought my career was over. So it just shows how your thinking can be distorted, and there's far more acceptance in the community and from friends and others and all the rest of it if you acknowledge a mental health problem. And the thing is, I knew I needed to address a number of things myself, including how I went about taking on certain demands and dealing with perfectionism, being prepared to draw on the support of other people, things like that, and had to make a number of changes which would have continued to this day. And so that was an example of someone experiencing a severe and chronic longer-term depression making a full recovery. And I would have been one of the worst patients of all because I knew all the strategies that the therapist was using, and I was thinking of how they wouldn't work before they started to use them. But even then, I made a full recovery. So I think that's part of it. People acknowledging mental health problems and also recovering from them as well is something ultimately that can give people more confidence. So for reducing the stigma, most people will experience a mental health problem at least some point in their life, and it's sometimes said that 80% of people at some point in their life will have enough of a mental health problem. It doesn't have to be a diagnosable disorder necessarily, but to justify seeking some mental health intervention. And so, and at very least, people acknowledging with one's GP about mental health, how you're tracking, as well as your physical health. Effective treatments are available, even for the more severe, complex problems. I've had a couple of family members who've experienced psychosis in the form of schizophrenia or bipolar disorder. They developed these conditions well after I started working in the field. And at the time I was surprised when those family members developed those conditions, but they were able to come to manage them very well using medication and certain other kinds of therapeutic support. And in their case, medication was an important part of the picture of their recovery. Acknowledging difficulty is a key, and acknowledging it early makes a real difference. Then there are things that you can do. The biggest difficulty people have with mental health problems, it's not the anxiety disorder they have or the depression that they're experiencing, it's people's non-acceptance of their depression or anxiety. It's the people's feeling ashamed about being depressed, or someone feeling panicky about having an anxiety condition, or people being depressed about having an anxiety condition, or being depressed about being depressed. It's people's sense of shame and non-acceptance of the difficulty, which is the main problem. And once people get around that, that really helps people's recovery. And so our work as psychologists is often a lot easier because people, by definition, are acknowledging a problem to come in the front door. And then, once people start to acknowledge their difficulties and find out how they're not alone and can be heard and understood, and that there are effective ways of helping people, that's where, as people accept having the difficulty more and then start to look at some strategies they can use to help rather than getting stuck in damning themselves, that's when the real progress occurs. So this is where workplaces come in, helping people acknowledge the difficulty, helping people seek help early by people not being punished in a workplace by acknowledging experiencing depression. And we've seen that recently, the benefit, for example, in certain footballers coming out and acknowledging that they've suffered with depression or some other mental health problem and helping make that more acceptable in the community generally. So acceptance aids recovery in extra gains. And compassion and social support helps people's recovery from any mental health problem. So we come back, what can help in workplaces, mental health? Let's look at what can help with the positive end of positive emotion, helping people be engaged, helping people have positive relationships, finding meaning in their work and achieving. Anything in a work culture that helps people have a sense of shared purpose or meaning, that will help for meaning, it'll help for achievement. A focus on staff strengths, that will help people's positive affect It'll also help our relationships, focusing on people's strengths rather than what they're not doing so well. Still, we can have high standards and look at the quality of our work, but working to people's strengths. Offering active social support, focusing on what went well. One of the main positive psychology strategies is at the end of each day, it can be in a family setting around the dinner table, asking your children, what are 3 things that went well today? A strategy that can work well for mild and moderate depression is at the end of the day, someone asks themselves, what are 3 things that went well each day? And that can make a significant difference. And then internal versus external motivation. It's what motivates us internally that makes the biggest difference to our well-being. What drives us from within, what we feel passionate about, what can get us up in the morning. That's the kind of thing that'll make the biggest difference. External motivation is, do this or else. Do this or you'll get in trouble. Also, if someone are just rewarded financially for achievement rather than being recognised for the qualities they've shown in what they're doing, that can be demotivating. Hey, you've done a really good job. Look, here's an extra $100 or whatever. Now that can be relevant, but even more is recognising the pride people take in their work and the qualities they bring to it. That's ultimately more meaningful. So something that helps satisfaction with work also is when we have a sense of flow, meaning there's a match between the challenges we face and our skill level. The higher our skill level, we want more challenges. And again, if we looked at a sporting analogy, if someone's an elite sports person, they want to be in higher level competition to have that sense of flow and satisfaction. Otherwise, they'll get bored. But if we're out of our depth, we'll feel anxious. Now, I'll mention something briefly where there's a blog on our website that you can follow this up, but I'll just mention it briefly because it's a positive psychology intervention which is one of the most widely used. And in the positive psychology field, how we can enhance our well-being, if you go to a congress, an international congress on positive psychology, 50% of what they focus on will be what we call character strengths or signature character strengths. It's what they look to incorporate in Geelong Grammar, and then subsequently a whole lot of businesses are starting to look to incorporate this principle. If you just think in the last few weeks or at some previous point in your life, when were you at your best? When are you look back with real appreciation at how you were at that time, you felt you're really at your best in the last couple of weeks or any prior time? If you have an image come to mind. The chances are, when you're at your best, you're acting on one of your top or signature character strengths. Our character strengths are virtues recognised by all cultures across all times. Our character strengths are things like curiosity or love of learning or social intelligence or sense of perspective. I mentioned there's a blog on our website you'll be able to look up that sort of lists character strengths and shows you how you can fill out a questionnaire online at a positive psychology website to work out what your top character strengths are. They can relate to courage, so valour, being prepared to speak up, courage to express your opinion, perseverance and integrity. It can relate to humanity, like kindness and loving. Or our top character strengths can relate to citizenship or leadership. If your top character strength is leadership, you'd want to be in leadership roles, otherwise you'd be frustrated in a setting in which you worked. We at least want to be working towards leadership roles. If leadership was one of your lower of 24 character strengths, and you're given a promotion which involves a whole lot of leading other people, you might be demotivated by that. It's a match between ourselves and what's best in us and the circumstance. Or temperance, self-control, humility, or can be transcendence, gratitude, spirituality, forgiveness, zest, humour, these different things. Now, if we can identify what our top character strengths are and look at ways of incorporating them in our everyday work, that's a way we're likely to get the greatest satisfaction. But if we can recognise the top character strengths in others, our colleagues, our children, our partners, we're looking to the positive energy, we're looking to the best in people and helping draw that out. As we have that mindset in ourselves, acknowledging the stresses we can face and how our stress signatures, but also how we bring out the best in ourselves in terms of meaning, achievement, purpose, that helps our mental health and well-being. The idea is to look to use our top 2 strengths combined, or our top strength and our lower strength, or look at acting on our top strengths in new ways. I'll highlight, again, we've got a blog on this, so I won't spend any time, but positive health, physical exercise is not only a physical health intervention, it's a mental health intervention. And this is where there are some blogs that you'll be able to find on our website. If you look at the education section, it'll include blogs on burnout, character strengths and physical exercise. And you'll see I have a couple of public talks coming up. I've got a note over there, but a couple of talks coming up relate to psychological awareness. One's on interpreting dreams, and another talk I have coming up is on synchronicity, which is uncanny coincidences, and so the notion of unwrapping the gift of coincidence, interpreting the uncanny coincidences in our everyday life for more understanding of ourselves. So I know I've only left a very brief time for questions, but there might be time for one or two questions winding up. Okay, so in terms of, for example, someone has an anxiety condition, how much do we look for people recovering and how much do we look for people managing with what's there? Now the thing is, many anxiety disorders will be relatively mild. Like many of us will have a phobia which has a fairly limited impact on our everyday life. And many people, for example, who seek help for a phobia will be able to overcome that fully, and sometimes, quite quickly. Sometimes even a few hours of treatment will make a real difference. If people have a very persistent long-term phobia, then it might be ways of managing it so they can still fly planes for work or whatever, but they might never be completely comfortable and calm flying a plane. And that can apply to a whole range of these other conditions, also like trauma reactions. Like having worked with a lot of Vietnam War veterans, for example, there'd be, after people presented for help for 20 years and were hospitalised for it, there'd be few people that I would have seen who made a full recovery from post-traumatic stress disorder. But the majority of people could manage it much better. 1/3 of people, when we see people with trauma reactions as well, like after a car accident or whatever, most people recover well, and I would say pretty much fully recover from a single event, like a car accident or an assault or something like that. But if people have had repeated and persistent child abuse, including sexual abuse right from a stepfather right through their childhood, for example, often people wouldn't have a complete recovery in terms of no longer having the markers or the impacts of that experience. But people can come to experience their life quite differently and can manage a lot of the symptoms a lot better and function a lot better in a whole range of situations. So it's a relative thing, but for more mild and moderate conditions, when people present for help early, often we're looking at recovery. For more severe or persistent conditions or complex conditions like some forms of schizophrenia or bipolar disorder, which also people can make full recoveries from at times as well, but the more severe or the more long-term the condition, the more we're looking at managing, I would say. And ultimately, it's about our relative mental health. So we're not just talking about mental health, good or bad, or does a person have a mental health problem or not? What we're looking at is all of us vary in our mental health and functioning. Sometimes there can be problems that are significant enough to call it a mental disorder. In those situations when it's mild or moderate or picked up quicker, you can be more confident of more full recovery. But even if it's more severe and longer term, there are a range of ways, including therapies, medication, that can help, and a key is to see one's GP. And so the thing is, the more confident and aware we are that there are ways of helping even the most severe conditions, then everyone's better off being able to acknowledge these conditions, including in the workplace, and for people to be supported while they seek help for that. It's likely to help not just that person's well-being and productivity, but ultimately workplaces will gain and people put up their hand sooner if they have some kind of difficulty, which in most cases people will be able to recover from in the vast majority of circumstances, but at times manage much better.
Any other questions there, Chris? You'll make them aware of their mental health or training protocol?
That's a really tricky question. If you're in a situation where your boss you felt had a mental health problem, how you'd approach it. First of all, I think it would depend a lot on the relationship. There had to be some circumstances where that could happen. I think ultimately be worth looking to do something rather than nothing. And I would think of who in the organisation might be the best person to approach that individual. Because it is worth it coming up and being brought to someone's attention. It can be a relief to someone ultimately to have it acknowledged, even though they might feel ashamed at first. But if there's someone within the organisation, it might be a peer at a similar level, or it might be a supervisor or manager of that person. But I think in one way or another, you'd look at the way that the person might most likely be able to hear and accept. But I think if it's done with the right intention, if it's done with some level of consideration and care, people can tend to pick up on that. And people might feel distressed about that coming up, but ultimately would tend to be relieved if it's pointed out that people notice some difference in how they are. It's a humane and compassionate thing to do, ultimately likely to help the person and also the whole organisation.
Thank you, Chris. Please join me in thanking Chris.
Thanks, Sean. Nice introduction. And I'm sorry Chris can't be here, but my presentation is a different spin of the same sort of stuff that Chris has presented around creating mentally healthy workplaces. So it's always a privilege to talk about this topic. It's something that's very dear to my heart, and it's a place where I've spent the last 30 years working towards helping demystify and destigmatise mental health in the workplace. So a little bit about my background to give you a bit of an idea of my experience. I work with Beyond Blue's Heads Up engagement team, and Heads Up is the new initiative that was launched earlier this year around making all workplaces in Australia taking up mental health initiatives. So Jeff Kennett wants 90% of businesses to be taking initiatives in the next 5 years. So everybody in the room, if everyone today, open up your packs when you get back to work, sign up for Heads Up, have a look, have a deep dive into it, and see how the resources, the research, the information and the usability of the website can really help you address not only your own mental health, but the mental health of those around you in the workplace. So I love working on that project. It's something that I was so excited about and felt very privileged to be asked to work and come and talk to people like you guys about it. So my 30 years experience within the corporate sector has shown me many, many businesses, from SMEs to big globals to, you know, one-man shows. Some workplaces address mental health in such a superb way, and I'll demonstrate through my own personal story how that happened for me. But also there are some organisations that are okay to talk about mental health or mention it, but do they walk the talk? Sometimes not, and that can sometimes have a very devastating outcome, not only for people but also for commercial outcomes as well, with businesses that just don't survive because they don't have the manpower to be able to effectively and efficiently run their businesses. And that's a mental health issue, surprisingly. I'm also a very passionate Beyond Blue ambassador, so I go publicly to speak about mental health in a very general perspective. So sometimes I speak at a rock concert or an education forum or to kids in schools, but I never ever tire of talking about it by way of destigmatising and demystifying it. I also consult within HR, so I develop and execute career transition, mental health workshops and leadership development programs. They're all underpinned by recognising the mental health and agility of the person that I'm working with. So instead of developing a program and rolling it out to anyone, I will always be addressing the person that I'm working with. And that's something that everyone can think about when you're working with people in any capacity. And that might mean, you know, you're working with somebody as a customer in a retail store. Think about who you're with. Just apply some basic care and compassion and kindness. They're 3 words that cost nothing. They can be applied freely, and believe me, the impact on a person's day, basic care, basic kindness and compassion, wow. We all know and we can all resonate with that, I'm sure. I'm going to tell a story about my introduction to the workforce, and I apologise, sometimes I do become a little emotional about this, so work with me, I'll be okay. but it's just a demonstration of what it means to me and how important my journey has been. So my experience of childhood was rather traumatic from when I can remember, and so at a very early age, at around 11, I got my first part-time job in a fish and chip shop. That changed my life. All of a sudden I had an identity, I had somewhere to go, and I had purpose, and I had somewhere to go that wasn't at home. It also gave me some independence. I all of a sudden had some money, so I was able to then go out into the world and start planning how I was going to make my life better. At age 15, the education system decided that they didn't want me there anymore and suggested strongly that I enter the workforce. So again, even in the education system, my mental health issues weren't addressed. So I was marginalised and rejected from the system because I didn't fit. So my first role was very fortunate. I entered into an SME, and the people that ran the business, just ordinary people, family business, doing it hard, you know, they were a start-up themselves. But what they gave me, and I've written down a few words that really resonate with me and hopefully with you, empathy. And that wasn't feeling sorry for me, that was actually understanding where I'd been and working with me around where I'd been, but still expecting the best from me. Encouraging me all the time. I think Chris mentioned something before about, you know, you can hand somebody $100, you know, and that really means nothing, but to actually say, that was well done. You know, I remember one time walking out of work, I felt like leaping in the air because my boss had said, that was fantastic. Empowerment, giving you something to work towards, making you responsible, not feeling sorry again, but making you responsible and giving you some objective to work towards. Understanding and acceptance, accepting me for who I was. Just because I didn't sound like everybody else, just because I didn't look like everyone else, didn't mean I wasn't going to be efficient and effective in the workplace. Trusted leadership is something that's always meant something to me. Leaders being authentic and actually walking the talk also. Going back to the mental health piece, we can talk about it and say our companies embrace mental health, but are we really doing anything about it? We can throw thousands and thousands of dollars at mental health initiatives. For example, companies that, you know, might introduce Pilates or fruit boxes or, you know, team building exercises. People don't really want to fall off the back of logs into their colleagues' arms, and, you know, I don't know anyone that wants to get into their undies and do Pilates in front of their workmates at lunchtime. They don't. So the leadership, you know, the talking about it, just talk about how you're feeling. Ask somebody how they're feeling. Like as Chris said, you know, if somebody's not looking like they did yesterday or last week, don't go to them and go, oh my God, you look awful, because that's probably going to send them further south than they already are. Going to somebody and saying, hey, you don't look as happy as you did yesterday, or your work's still really good, but last week you were really productive. Are you okay? People are more inclined then to open up a little bit. And if they don't open up straight away, you don't have to persist, because that's probably going to exacerbate it. But people knowing that they're being acknowledged and validated, it goes that little small way into helping people feel like they're not having a stigma attached to them and more likely to get on the journey. I've talked about kindness and care again, and I'll probably repeat it another 100 times in my presentation today. I hope it resonates with you all. You know, even a person in the street, say hi, could change their day. So in terms of my journey, I continued to choose employers that meant something to me, that I resonated with, who gave me an opportunity to succeed. So as I travelled through my career, I ended up being so well supported that I ended up in university. And that wasn't until I was 40. So my employers supported me in being flexible. I was a single parent at this stage with 3 young kids, and I was able to manage a full-time degree, work, and my kids happily without stress, and study towards something that really meant something to me, and that was about helping people. So again, everybody, if you're an employer or an employee, really look towards how you can help a person by being a little bit flexible to achieve and to succeed. Because often there is pressure put upon us in high performance cultures or, you know, highly productive organisations that really aren't beneficial to a person's mental health and well-being or physical health and well-being. So with all that said and done, and I made it through my personal story, today we want to inspire change and a call to action around really addressing mental health in the workplace. And I always find it funny, you know, we talk about mental health. It sort of gives the idea that somebody's ill. But if we talk about physical health, that means somebody's really fit and healthy. It surprises me that the two don't go together. So for example, to demystify things a bit or to simplify mental health, if I were to trip over this cord now and fall onto the ground and break my arm, you would all probably rush up and see that I was okay. You'd give the care, the compassion, the kindness. Then you'd call an ambulance or you'd bring in a doctor. None of you are going to try and fix my broken arm unless one of you are a GP. Same with mental health. When you see that somebody's not well, administer the care, the kindness, the compassion, and the referral and the resources to help them get better. Sometimes the broken arm can turn into an infection. It might take 6 months to get better. It might turn into gangrene and never get better. Same with mental health. A simple mental health issue, untreated, can turn into something quite serious, but treated and recognised and seen to quickly can stop it from exacerbating. And that was something similar that Chris said before. So I want to talk to you a little bit more about Heads Up, although I know that you've all got packs in your bags and I don't want to complicate things too much and I want you to have a read about it. But there are so many tools and insights there on Heads Up that can help you talk to people around you about mental health. So when you don't know what to say, Heads Up has got the words to tell you what to say. You know, when you don't know what to do for yourself, when you don't know how to help yourself, it's got the words, it's got the resources, it's loaded with case studies, studies material, full stop. So if you're a leader or an organisation who really wants to demonstrate to the more analytical people what it really means around workplace, it's all there as well. So I know that as part of Healthy Together Victoria, there's an achievement program. Heads Up can be a component that you can use to help you achieve what you need to get the outcome for your achievement program as well, by way of addressing mental health, creating an action plan and executing the action plan around your workplace. Again, going back to my experience of working with leaders and organisations, ignoring mental health costs Australian businesses billions of dollars every year. I want to say billions of dollars every year. Quite often we'll think, you know, people not turning up to work or workers' compensation claims. About $6.2 billion is lost in presenteeism. And I'm not sure if everyone knows what that means, but that means people turning up to work, but they're not being productive because they're highly disengaged, they're highly demotivated, but they feel the shame and the stigma attached to not feeling well, so they'll just turn up anyway. That's detrimental to those around you, the person that's suffering and the organisation. So that's a lot of money that can be turned around very easily by a few simple things that, you know, workplaces can do that are genuine and authentic. So investing in mental health programs, it does provide a significant return on investment, and that's also demonstrated through the studies that Heads Up promotes on the website. There are a lot of leaders that we talk to, as I said before, that really do say, yes, you know, we're doing mental health. I was with an organisation the other day, a very, very prominent global organisation that asked me to come and talk to them about mental health. And I presented to, it was a blue collar workforce, very large crowd. And after my presentation, 3 people came up in tears. One was a guy about this tall, he had a beard, he had the spaces, he had the tattoos, and he was in tears. And he was happy to do that in front of his human resources people. To say to me, Ray, sometimes I can't even get into my car after work because I feel so overwhelmed by anxiety from this workplace that I can't even function. And the HR people stood there. And whilst I was talking to this man, one of them said, "Oh, I've got to go now." And the other one said, "We've got to wrap it up now." And I was really perplexed. And then they said, "Hey, guess how much money we raised for Beyond Blue?" There is not enough money you could have thrown at this man to make him better. However, if they could have turned around and said, "Hey, we're listening to you," that would have been different. I was absolutely horrified. And I said to the HR leader, I said, "How did you think that presentation went?" And he said to me, "It was great, it was fantastic, you nailed it, but don't place so much emphasis on creating a mentally healthy environment in a workplace." I said, "How's that?" And he said, "Well, it's never going to happen here." And I said, "Why?" And he said, "Well, it's just not productive." And I said, "Mate, a few years' time it'll be legislation and you won't have a choice." And he said, "Oh yeah, right." And I went away from there. I don't have words to describe how I felt, but it just spurs me on even more to say to you authentically from the bottom of my heart, take this seriously, take it on, think about it, do something about it, talk about it, whatever you need to do. It's not rocket science. There's no formula. There's no amount of, programs that we can create. If you just talk to each other, that's making change right from the get-go. 6 people every day die from suicide in Australia. 5 of those are men. And that's just staggering, and we have to make change. And I've gone a bit off topic, but I get a little bit passionate about it. I think we've pretty much covered most of what's on this slide, but again, make the investment. Doesn't have to be financial all the time. It can just be investing in your own thoughts, in your own self, in your own ability to help those around you and also help yourself. Quite commonly it's expected that leaders are responsible for the mental health and mental well-being of their staff. Well, yes, they are. They're responsible for creating an environment that is conducive to supporting the mental and physical health and well-being of people. You see OH&S that was introduced, 22, 23 years ago, and we all went, yeah, right, as if that's going to float. You do not go onto a work site these days and see anyone out of a high-vis outfit. I'm not on a work site. But you can see the change. I was at Linfox the other day who, incidentally do mental health very, very well. But I couldn't walk up the stairs in high heels because of the OH&S liability that could have occurred. So people are addressing that. So mental health is exactly the same. We can do it. We just have to get on it. Here's a bit of the research that I talked about before in terms of the presenteeism. I think I said 6.2. It's probably at 6.2 now because this was created a few months ago. Absenteeism 4.7 and compensation a really small amount. You'd think that that would be one of the higher ones, but $10.9 billion. That's a lot of money. That's a lot of money when change could be made. Here's some, confronting statistics around what depression and anxiety looks like in Australia, which sadly and tragically often leads to suicide. So you can see, as I said before, here, 6 every day, 5 being men. In depression, 1 in 5 women, 1 in 8 men are likely to experience depression. And that's only people that turn up and actually are diagnosed. So the rest are just suffering very, very silently and in shame. Anxiety, the same thing. I think, Chris painted a really good picture of what anxiety looks like and what it might feel like. And I'm sure that, we've all at times been quite overwhelmed. The Heads Up Action Plan, which you'll read about, is really simple. It's something that you can get on as an organisation or as an individual and create an action plan of what your workplace should look like. So quite often when I'm consulting to organisations, for a large global organisation, I might suggest, dividing up your organisation into silos where, there might be a blue collar component, there might be a corporate component, there might be an on the road component in sales. So getting a champion for each of those divisions of an organisation who then feed up into the larger committee that are really, really supporting Heads Up as an initiative, it can be a really, really cathartic and tangible way of addressing mental health, but really being able to see the outcomes. and all getting together, not just having one person, not just having the leader, but having the whole community, the work community involved in a way that is, you know, very collegiate. I think I've seen on many occasions how this makes change really, really quickly. And you know what? It just gives people permission to talk about it and do something about it, rather than having somebody like me just come in and talk to you about it on one day and you'll go away and say, oh, that was great, or that was terrible. Go away, and then by tomorrow, we're back to our same selves. So mental health, like physical health or anything in the workplace, in productivity, it needs to be a continuous improvement process, continually addressing it, growing, changing, developing, just as you would if you were manufacturing a product. You're manufacturing really, really good, strong mental health. Chris did cover signs and symptoms as well, which I guess, you know, a lot of my information resonates quite strongly with that. But these are things to really look for in the people that are around you, not just in the workplace, but around you in general, because you really could be saving somebody's life. Like I said before, when you're approaching somebody, I think somebody up the back asked the question before about a manager. If your manager's suffering from, or you feel that they're suffering from mental health challenge, how do you approach a manager? They're just people. They're just people. They would appreciate it, because a lot of the leaders that I work with in leadership development, when we really peel it back, they're scared because they have to be leaders. And if they're seen to be weak, their feeling is that the rest of the organisation is going to crumble because they're not leading. But leading by example, it has the greatest, most effective impact when a leader is authentic and genuine about their own human state. You know, and that doesn't mean you're coming to work and crying and not able to do your job, but actually standing there and saying, hey, I'm human as well. Let's all be in this together. Let's all lead together. It has an amazing impact that resonates throughout the organisation. So, as Chris said, the best way to approach somebody in the workplace, if somebody else has a really good relationship with the person, speak to them, ask how do we approach, or maybe they approach on your behalf. But don't be frightened, because again, you could be saving somebody's life. You can't break anyone by asking. Now, we talked about the achievement program, and again, I've read a lot of the resources that have been created by Healthy Together Victoria, and it's fantastic. And it also feeds in very well with heads up resources and information as well, but whoever wrote it should be commended. No, it really is fantastic. I've not seen anything like it before, and so happy to have it so. This is our YouTube clip that's been created as part of the Heads Up initiative. We have loads of case studies, Heads Up clips that will help demonstrate what Heads Up means, what a mentally healthy workplace means, and this one is around more increasing awareness. So how do we do that? What does it look like? And what are the words that you can use in your workplace?
Recent TNS social research has revealed that 9 in 10 Australian employees agree it's important to work in a mentally healthy environment. However, only 5 in 10 believe their own workplace could be described that way. For an employer, raising awareness is a key step to creating a more mentally healthy workplace. This can be achieved through raising understanding of the signs and symptoms of mental health conditions, showing the benefits of creating a mentally healthy workplace, and demonstrating what your organisation is doing to make a difference. Awareness initiatives take a range of different forms, from talking openly about mental health in the workplace, providing training for staff, to incorporating mental health as a part of staff induction and management training programs. Other initiatives include making mental health information freely available, getting your workplace to participate in mental health related events like Are You OK Day, and promoting support services such as employee assistance programs, helplines and referral services. The TNS research also identified that an alarming 1 in 3 employees have reservations about working with a person experiencing depression or anxiety. The stigma associated with mental health conditions means that currently some people are seen in a negative light. This can affect the way they view themselves, which in turn stops them from talking about their condition and seeking support and treatment. But employers can help reduce the stigma associated with mental health conditions. The most effective way is to bring people in your workplace into contact with those recovering from anxiety and depression. By seeing that they are just like anybody else, employers can help break down preconceived notions and put an end to negative stereotypes. There's more on how to increase awareness and reduce the stigma of mental health in your workplace at headsup.org.au.
Thank you, Ray. Great ambassador of written for inspiring change toward destigmatising mental health. Thank you for coming all the way from Melbourne.
Thank you.
And please join me in thank you.